Another very helpful resource is the IHME Data. This is data from an independent global health research center at the University of Washington, which for decades has provided data for the World Health Organization, the Gates Foundation, and many others. Their COVID-19 tracking data uses predictive models to show projected trends in the number of cases, utilization of resources like all hospital beds, ICU beds, invasive ventilators, and number of deaths. There is data for all the US states and over 25 countries all over the world. Their predictive models use COVID-19 data, population mobility from mobile phones, and information about social distancing guidelines that have been enacted in each state and country. States can also be using this information to estimate when social distancing can be relaxed, like this data from the state of Vermont. A final resource is called Rt.COVID-19. This reports on how fast the COVID-19 virus is spreading. This value is summarized in the value of R0, which is the number of people that an average infected individual will further go on to infect. Values over 1 mean that, on average, each infected person infects more than one other person, so the number of cases in this area will grow. Values below 1 mean the number of cases will decline. These data are present for every state in the US, as shown below, and these summarize how effective our measures have been in controlling an outbreak and guide decisions about whether to increase or reduce physical distancing restrictions, balancing both human health and safety and the need to reopen the economy. One limitation of almost all COVID-19 data is that they usually reflect only cases that are reported by health centers. Many people with COVID-19 might not be included, either because they don't have symptoms or have not sought or obtained testing because their symptoms are mild. There are two other important resources I would like to highlight. The first is the National Students Response Network, or NSRN. As medical schools from all over the country rally to coordinate volunteer efforts, NSRN, or National Student Response Network, is working to help fill the volunteer needs of hospitals and public health departments and match them with nearby health professional students. The other is our very own Medical Student COVID-19 Action Network, or MSCAN. We have created an interactive map showing volunteer efforts by medical students all over the country. So far, we have over 430 activities from 90 medical schools in 38 states. We are now working on making additional informative videos for you all as well, and we would welcome your ideas about videos that would be most helpful.